If your cat has started hiding more than usual, this is often the first silent sign of environmental pressure, fear, or stress. Startling at the sound of a door, a guest, or even a small movement and quickly retreating may indicate an increased state of alertness. If it lowers its body close to the ground and curls up tightly, this may now signal tension and the need for self-protection rather than comfort. Flattening its ears to the side or backward may indicate that it does not feel safe in its environment and feels under pressure. A noticeable dilation of the pupils without any change in light can be a response related to fear, arousal, or stress. Forcefully swishing its tail or rapidly flicking the tip may be a sign of discomfort and rising internal tension. Avoiding contact it normally enjoys or suddenly moving away while being petted may show that it is protecting its boundaries more firmly under stress. Spending less time with you at home and retreating to secluded areas may be a sign of social withdrawal due to stress. Not responding to play invitations as much as before may indicate reduced mental comfort and that it is allocating its energy to defense. If it watches from a single spot for a long time instead of exploring, this may be a state of alert waiting rather than relaxed curiosity. Grooming itself more frequently than usual, especially repeatedly licking certain areas, is an excessive grooming behavior associated with stress. A noticeable decrease in grooming is also important. Some cats may even deprioritize self-cleaning when stressed. Excessive licking that begins without skin redness should be carefully considered first in terms of stress and then possible medical causes. A sudden decrease in appetite, going to the food bowl and then turning away, may strongly suggest that the cat is under environmental pressure. Some cats, on the other hand, begin to eat more frequently when stressed. Even if the direction changes, sudden differences in appetite behavior still require careful attention. Unexplained changes in water consumption can sometimes be seen alongside stress, but medical causes should also be evaluated. Spending a long time in the litter box but not being able to relieve itself comfortably may be related to environmental pressure or tension. Disruption of litter box habits, such as urinating or defecating in different places, is considered one of the common reflections of stress in cats. Spraying urine on vertical surfaces is one of the signs seen especially in cats experiencing tension or territorial pressure within the home. Using the litter box as a sleeping or hiding area may be a passive sign that it does not feel safe. Appearing more aggressive than usual, with increased hissing, growling or swatting, may be fear-driven. Reduced tolerance toward other cats or people may indicate an increased social burden and a decreased ability to cope. Sudden biting or hitting with its paw is not always anger, but often an expression of accumulated tension. Constantly checking windows, doors, or corridors may clearly suggest an expectation of an unseen threat. Tense-looking muscles even while resting, inability to relax into sleep, and frequent repositioning may align with stress. Disruption of sleep patterns, increased nighttime activity, or fragmented daytime sleep may be linked to restlessness. Frequently changing places and being unable to settle may be interpreted as an inability to feel safe in the environment. Avoiding climbing to elevated areas it normally uses may be closely related to a loss of confidence and a sense of environmental pressure. On the contrary, constantly climbing to high places and observing from above may indicate an increased need to control the environment. Choosing narrow spaces, such as under furniture or behind cabinets more often, may suggest a strong desire to remain unseen. Acting overly cautious toward visitors and staying out of sight for long periods may indicate difficulty coping with new stimuli. Reacting more strongly even to familiar sounds may suggest that the nervous system is operating at a heightened level of arousal. Showing intense avoidance when seeing objects like a carrier or a vacuum cleaner may be a learned stress response. Rubbing its face, cheeks, or body against objects more than usual may be an attempt to create a sense of safety through scent marking. A noticeable increase in scratching may not only be about claw maintenance, but also a way of marking territory and releasing tension. Overreacting to small changes that previously did not bother it may indicate reduced flexibility and a lowered threshold. Immediately changing behavior when the home routine is disrupted clearly shows how much it relies on predictability. If it lives with another cat, behaviors such as blocking pathways, guarding doors, or silently following may indicate tension within the home. Choosing distant routes instead of approaching the other cat may be seen as a passive stress behavior avoiding social conflict. Stopping frequently and checking surroundings while moving from one room to another may clearly suggest that it is calculating risk rather than feeling secure. Losing interest in toys it normally enjoys and showing reduced response to rewards may indicate emotional burden. It should not be forgotten that purring does not always mean relaxation. Some cats purr to self-soothe when anxious. Excessively scratching the ground after using the litter box or trying to cover it for a long time may indicate increased tension and a desire for control. Waiting for long periods in front of closed doors or searching for an exit may indicate that it does not find the current space safe enough. Repeated cycles of excessive licking, followed by sudden stopping and restarting, may reflect inner restlessness. Sudden bursts of running inside the house without an obvious reason may sometimes be the release of accumulated tension. A tense breathing pattern with a closed mouth, even without a clear increase in breathing rate, may be a warning sign that should be monitored carefully. Pulling its whiskers back toward its face and slightly retracting its head may indicate that it does not want approaching contact and feels under pressure. Tucking its paws tightly under its body may represent a defensive posture rather than a relaxed resting position. Frequently checking the surroundings even while eating may suggest that it does not feel completely safe, even during basic needs. Slowed movements do not always mean calmness. Some cats deliberately move less when stressed to remain unnoticed. Becoming unusually clingy to its owner can also be a sign of stress. Some cats stay excessively close to their source of security under pressure. Freezing in response to external stimuli and remaining motionless for long periods without making a sound is passive defense rather than active escape. Frequently watching out the window may increase environmental stress if outside animals or sounds are perceived as threats. The appearance of multiple symptoms at the same time supports the likelihood of stress more strongly than a single behavior. If symptoms started suddenly or intensified rapidly, not only behavior but also underlying pain or illness should be considered. Stress symptoms often begin subtly. Noticing small changes early can help prevent larger behavioral problems. A deviation from your cat's usual routine alone does not provide a diagnosis, but it indicates that behavioral changes should be taken seriously. If hiding, excessive grooming, litter box issues, and aggression occur together, professional veterinary support may be necessary. Stressed cats are often quiet. Therefore, appearing calm does not always mean they are truly relaxed.